Welcome back to Business Today. I am your host, Pat Trotter, and my guest for this segment is Dr. Lawson Richter with Compassionate Care for Women. I thank you for joining me.
Thank you, Pat.
Tell me a little bit about Dr. Richter. How long have you been at Compassionate Care, and what did you do before that?
Been at Compassionate Care in Las Vegas for about the last 15 years, and then have been honored to serve the population of Pahrump for about the last 10.
Okay. And before working in Las Vegas, what did you do before that?
Unfortunately, I was having to work in Hawaii and lived there for about 14 years.
I know you just hated that, didn't you?
Well, it's the weather. It's always the same every day. It's just the same. So when it came time to have a family, we needed to be around our family, so we came to Las Vegas, and then was invited to come out to Pahrump one time, and saw 3 patients, turned around and went back to Las Vegas. Fortunately, we've been blessed and had great growth, and now we're here 2 days, going to soon make it 3 days a week.
Okay. And Compassionate Care for Women, you're right over by the Professional Center as well. Is that correct? Over, I think it's 1480 East Calvada, Suite 700?
Yes, sir. We're just on the other side of the helipad, which would be down from the new pharmacy, just this side of Pahrump Valley Boulevard.
Okay.
Now, when you drive by, though, it's a little deceiving. You'll see the big OBGYN sign, but the parking is really in the back as you drive by the front. So have faith, go all the way around, and you find plenty of places. Otherwise, kind of a lot of rocks in front.
Exactly. The phone number there, if I remember right, is 775-537-1010?
You always remember correctly. Yes, that's it. That's it.
So tell me, how's it been since you opened here in Pahrump for Compassionate Care?
Well, there have been a lot of new changes for ladies, which of course we've tried to keep up with. But at the same time, we've been blessed by having a tremendous growth over these last 10 years. What is really exciting now is that so many of the modalities that ladies either had to go into Las Vegas for or go someplace else for, we can now almost do in the office. I mean, even the world of tubal ligations, which used to require preoperative hospital stay and so many things, we can do in 10 minutes in the office, just as an example.
Right.
But at the same time, we can bring prenatal care, testing bladders that have attitudes, checking for abnormal bleeding, contraception, high-risk pregnancies. So much of what required ladies having to go all the way into Las Vegas to take care of, we can now monitor in the office. I mean, in conjunction with perinatologists or urogynecologists or whatever specialty we have, but just bring more of the services to Pahrump without having to make the population have to go so far out of their way to have good health care.
And it's fantastic that now most of the procedures that required women to go to a hospital you can now do right here in Pahrump, correct?
Yeah, in fact, last week we did a tubal ligation on a lady, and she called me about 3 hours later telling me that she was outside barbecuing with the family and felt perfectly fine. How come she didn't hurt? And I said, I told you that. And she said, yeah, but this is not the way it's supposed to be. And I said, well, you can go inside, tell the family you hurt, and let them wait on you. She goes, that's a great idea. So my point is that not everything is for everybody, but when a lady has a concern, to be able to diagnose it, offer them options, explain it to them so that it just makes regular old horse sense, I think is what the population of Pahrump deserves. The population anywhere deserves.
Exactly. And with you having the office in Las Vegas and here in Pahrump, if they have concern, they can always get a hold of your office, correct?
Oh yeah, we're 24/7. Excuse me. Until we can predict when babies are going to come, this business is 24/7, regardless of what it is that is of concern.
So, bottom line, what it comes down to, if you do have a patient that has a concern, they have a way. can they just call the local number, or do they need to call Las Vegas?
If they call the local number, it flips to the Las Vegas number. If it's after hours, that number will flip to the operator to find me. So like I said, that telephone number is 24/7.
Okay, fantastic. So again, people have the option now, instead of having to go to the hospital, run right away, they can call you on the phone and probably get answers a lot faster than they could if they ran to an emergency room.
Well, to be honest with you, the emergency room serves a great purpose.
Oh.
On the other hand, many times, like you say, they can find out, get a better idea of what's going on, and that way we can give a timely appointment and give the lady some advice while she's at it.
Fantastic. The Compassionate Care for Women, when you started it, my understanding from what I've seen and heard, compassionate is really what you are.
That's exactly what we're trying to say, is that unlike maybe a larger medical group where they have a certain number of patients that they have to see every day, we can trim our schedule, we can micromanage it based on what the lady needs, because we don't leave an office, we don't leave an exam room until the lady looks me in the eye and says, okay, I understand what's going on. And that's all I ask. And if she understands, I don't have a problem with compliance, because it becomes her idea. At the same time, to be able to give ladies options is perhaps the most important thing, because ladies know their body very, very well.
All right. We'll be right back after these messages. Welcome back to Business Today. I'm your host, Pat Trotter, and my guest for this segment is Dr. Lawson Richter, again with Compassionate Care for Women.
Thank you.
We had talked a little before the break about compassion, and one of the things that you have and you stress to your patients is that you make sure they understand everything before you tell them, okay, we're done, don't you?
That's important, because they're going to be able to look for me and watch for the changes that might be significant. And if they think they are, then we need to make sure that they're not. And the only way to do that, of course, is to have them let me know. So we ask them to contact us, have an appointment, or do something. Yes.
Okay. And we had talked a little bit through the break. Some of the things that a lot of women forget to do is some tests that should be ran. And I was hoping I could get you to tell everybody what kind of tests and how often particular age groups need to stress more on, if you follow what I'm saying.
There are changes that are coming down the pike that will probably supersede some of the recommendations that I'm making right now. But if I can step back before these changes are put into place, every year I would recommend that a lady consider having, depending on her age, a mammogram. It's usually done once between the ages of 35 and 40, and then after the age of 40, it's usually done once a year. That can help find things that neither the patient nor I would be able to feel. Number two would be a pap smear. It's a screening test for cervical cancer. If we find things early, then we can put a stop to it and prevent the lady from having bad ramifications or even needing to have more extensive treatments. A pelvic exam is getting to be a little bit passé, but if a patient has a significant finding, we can supplement that annual pelvic exam with an ultrasound. So things that can affect ladies are things that we should be proactive on.
Okay, the first item you had talked, or the second item I should say, that you talked about was pap smear. How often should they have that done?
Well, again, the indications, or I should say the recommendations, are going to change, but we still recommend that that's done once a year. If that's supplemented with human papillomavirus screening, then some authors are now recommending every 2 years. And then I guess, again, for some of our younger patients, we can make it even less frequent than that.
Okay. And when it comes to the OB or obstetric side of your practice, they should start seeing you how soon once they know that they're pregnant?
Yesterday. Because the sooner we can date the pregnancy, the sooner that we can do an anatomical inventory and make sure that everything looks normal, the sooner we can do the blood test to look for any abnormalities and things like that, the better off we all are. Because again, the sooner, the better.
Now, how much, as far as the obstetric side, how much can be done right here in your office in Pahrump?
Probably about 98%. And the reason is because we can speak with or communicate with the perinatologist if there's a concern. If she has a medical complication, then we can talk to internal medicine doctors. So we try to bring the specialist to the patient as opposed to making the patient having to go in for other modalities. But the bottom line is that first we have to find them. And
Okay.
that's why early intervention is always the best. Let mom know that everything's okay.
So basically, I guess what you're trying to tell us is that if you think you're pregnant, get tested right away.
Absolutely.
Okay.
And if you want to be pregnant, then we're going to work on that. And if you don't want to be pregnant, then we'll work on that too.
On the other side of the coin, on your gynecology side of the coin, when you were talking briefly, is there other tests that women should have other than what we've already talked about?
Sometimes in medicine, it's a matter of trying to prove what you're not in order to kind of prove what you are. So if a lady has symptomatology that she feels is abnormal for her, then we should try to prove that everything's okay. Once we do that, then we can open up the world of treatments or modalities or things that we can use for the patient in order to make her feel well. Because again, unfortunately, patients can have pain, but doesn't always mean that there's doom and gloom. But first, let's make sure that there's nothing bad going on, and then let's try and make the lady feel better and have some quality of life, which is the essence of what we're trying to do.
Right. Again, we're going right back to compassionate.
It's important.
Exactly. And one of my questions, you had talked about 98% of things can be done as far as the obstetric side. As far as the gynecology side, is it about the same?
It can be.
Okay.
In order to do some of the newer modalities, such as removing the lining of the womb, tubal ligations, all these modalities. Now, we don't do hysterectomies. But fortunately, in this modern day and age, that's actually getting to be an uncommon thing to have to do. We have so many things in our armamentarium that we can use that we can many times, most of the time, make the lady go back to having a full productive life, not hurt or have bleeding or having problems, and not have to do surgery.
Fantastic. Once again, I'm going to let everybody know exactly where you're located at. They are at Compassionate Care for Women is located at 1480 East Calvada, Suite 700. They are directly across from Urgent Care here in Pahrump. Their phone number is area code 775-537-1010. I want to stress, one of the things that you do that I've noticed that you mentioned is you make sure that the patient understands what's going on with them, correct?
How can a patient really feel as though, and let her family know that she's okay if she doesn't understand what's going on? We may have to have a little time between the onset of treatment and having results, but if the patient knows what to expect, she's my Sherlock Holmes, she's my guidepost as to how we're doing. Not every patient is going to be able to have the same treatment, but that's the point. If they teach us in school, if you just shut up long enough to let the patient tell you what she feels and what she knows, they'll hand you the diagnosis in many, if not most cases. It's when we as professionals start trying to tell the patient that this is what's going on, maybe we're losing track of what the most important issue is to work with the patient.
Again, folks, that is Compassionate Care for Women, 1480 East Calvada, right here in Pahrump. We'll be right back after these messages.
Thank you.